New modelling prepared for the government shows that South Africa, which has the most confirmed coronavirus cases on the continent, will likely be hit by a fourth wave of infections, but its impact probably won't be as severe as during earlier stages. South Africa recorded 887 new cases of Covid-19 in the last 24 hours. However, all viruses, including SARS-CoV-2, do change over time. Some changes may affect the virus's properties, such as how easily it spreads, the associated disease severity, the performance of vaccines, or other public health and social measures. To discuss that, what we can expect going into the festive season, we're joined by Prof Mosa Moshabela, who is the Deputy Vice Chancellor of Research and Innovation at the University of Kwa-Zulu Natal. Professor, good morning. Always good to speak to you and get insights into what's happening in this dynamic world of COVID. Now, the Delta variant, as an example, gave us many sleepless nights a few months ago. Where is it at the moment, and has it evolved? Are there other viruses on the horizon that we should look out for?
Good morning, Hugo, and it's a pleasure to connect with you, and greetings to the viewers. Yeah, no, it's indeed been a week of full of activities around the developments around COVID this week. And indeed, the information that we have received from the NICD on the issues around variants. The current information is that South Africa is still dealing with the Delta variant. The Delta variant has not evolved to any greater degree in any of the provinces in South Africa. There are small variations here and there, but they are not significant. The one that we were concerned about is called Delta Plus, the AY42, which we've seen in Europe, and it seemed to suggest that it may be slightly more transmissible, about 10% transmissible, more than the Delta that we had here. But we have not detected this variant in South Africa yet. Any of the other variants that we were concerned about, like Lambda and Mu, have not been detected. The one that we picked up here in South Africa, the C12 variant, is still at a very low level, less than 5% in all the provinces. So the dominant variant is still the same Delta that we dealt with during the third wave, for all intents and purposes.
Prof, you speak about Europe and the challenges that they're currently facing. I mean, numbers are increasing in the UK, in Germany, to astronomical, unimaginable numbers, if you will. Now, with festive season comes obviously travel, and we are off the red list in the UK, so we can expect that many South Africans will holiday across the world, as will other nationals come into South Africa. Is this likely to cause us problems over the next few months?
Yeah, it's a very important question. I think that what we are seeing globally is that South Africans are now allowed to travel to different parts. And I mean, even the US now is opening up to South Africa as well. A lot of people from those countries are coming to South Africa. And the difference this time around, which I think it's significant, is that to enter into South Africa, and this includes for South Africans who leave the country and have to come back, one needs to have a negative COVID-19 test, PCR, which is less than 3 days. And also you need to demonstrate that you have been vaccinated to enter into South Africa. If you cannot demonstrate those two things, you cannot enter. This is, for me, I think that a layer of protection for South Africa that in as much as the country is allowing travel, it may protect us a little bit from sort of seeding new variants from elsewhere. Of course, it's not watertight. There may be some sort of people infections that may go through the border, but to a large extent, Hugo, I think that the measures put in place are going to play a role in protecting South Africa. I think that the main problem that we're going to face is less a problem that's coming from outside, but the problem that is brewing from within the country.
Now, I can imagine that if it's to be attributed to anything, it's obviously all the electioneering that went on ahead of the November 1st polls. We saw many voters attending rallies, not wearing masks, not social distancing. We've been stable. The numbers have been stable over the last few weeks. Only in the last few days have we gone above 800. I think 872 in the last 24 hours. Are we starting to see the effects of what could have transpired during that election period?
Yeah, so this is a very important question. I think that firstly, the point you make about the sort of behaviors and practices during the electioneering, as well as I suppose on the day of the elections. In many respects, it has disappointed a lot of us, a lot of South Africans, and unfortunately, it has also eroded further the goodwill that many South Africans may have. But I think that, you know, we will make a mistake, Hugo, if we leave the fate of our future and our well-being only in the hands of politicians and behaviors and practices during a political season. We have to take responsibility. We cannot be so upset that we disregard safety just because we are upset with what we saw. I think that has happened, and in many ways we can debate about it, and also, you know, say what the pros and cons are. It's done now. It's finished. And nobody has complained about how elections were not free and fair. We accept that they were free and fair. Right now, we now have to deal with the consequences. From the 15th of November, beginning of last week, we have started to see an increasing trend in Gauteng. We are starting to see an increasing trend in Northern Cape. And we can, it's 2 weeks after the election date of the 1st. So it's possible that, you know, the engagements, the social mixing that happened has triggered this increase that we are currently seeing. Our positivity rate is now 2.8%, nearly 3%. So we can, you know, without necessarily firm association data or causality, but based on correlation only, say that the two are related.
Professor Moshabela, thank you so much for your time. Always appreciate chatting to you and getting some of those insights. Professor Mosa Moshabela, Deputy Vice Chancellor, University of KZN, and that conversation around the numbers in COVID cases that are starting to rise and the possibility that they can be linked to all the electioneering that took place a few weeks ago.